Greetings, everybody. My name is Dr. Eric Joseph. Thank you so much for coming. I hope that you enjoy this presentation that I initially gave in September 2010 to the American Academy of Facial Plastic and Reconstructive Surgery. Today's October 25th, 2011, and the topic tonight is non-surgical facial rejuvenation utilizing liquid injectable silicone. I'm going to start with a brief introduction about myself and my practice, and I'm going to follow that with a description of what's called the serial puncture microdroplet technique, which is a specific technique of delivering liquid injectable silicone properly. And I make a distinction that there's a difference between injecting silicone and injecting other injectable fillers. So I'm also going to show a demonstration on the video of exactly how silicone treatments work. After that, I'm going to discuss some applications with liquid injectable silicone with lots of pictures, including non-surgical rhinoplasty procedures, filling in lower eyelid grooves, facial volume replacement, filling in lines, wrinkles, folds, and grooves, lip augmentation, and acne scarring. And then I'm going to have a candid discussion about complications that I've seen in my practice after performing over 1,300 procedures. After I conclude with silicone injections, I'm going to go off topic briefly, and I'm going to chat a little bit about Botox cosmetic for frown lines, forehead lines, and crow's feet. I'm going to talk briefly about LIS, which is a topical medication that's applied to the eyelashes, and it allows eyelashes to grow longer, thicker, and darker. And lastly, one of my great passions in life is rhinoplasty or nose job surgery. I'm going to show some examples of that as well. So I graduated from SUNY Stony Brook in 1988 and went on to go to medical school at SUNY Downstate, where I graduated in 1992. I did my internship and residency at SUNY Downstate, and that I completed in 1998. I subsequently went on to complete a fellowship in advanced facial plastic and reconstructive surgery with Dr. Alvin Glassgold in Highland Park, New Jersey. And I am certified by the American Board of Otolaryngology and the American Board of Facial Plastic and Reconstructive Surgery. I've been in private practice for 12 years, and I have a combined practice of general adult ENT and facial plastic surgery. This is a menu of my cosmetic services. The important ones that I like to do are a max lift short scar facelift, neck liposuction, chin implant surgery. I'm very passionate about otoplasty surgery or repositioning people's ears so that they're closer to the head if they have outstanding ears. And again, completely natural rhinoplasty surgery is one of my great passions. In the no downtime non-surgical arena, that's going to be the gist of tonight's discussion. Most of what I do in the office is with liquid injectable silicone, and I also utilize some Botox cosmetic for the upper 1/3 of the face. I'd like to take a moment and mention that we have a wonderful esthetician in our practice. Her name is Mila, and she performs microdermabrasions and chemical peels. And on top of that, we have a Palomar Starlux intense pulsed light machine that we utilize for photofacial procedures and permanent hair removal. So a lot of patients and colleagues will ask me, Dr. Joseph, how did you get interested in injecting liquid injectable silicone? Why are you so passionate about this? How come you don't use other injectable fillers like Restylane, Radiesse? There's a bunch of them that are out there. And it really started in my fellowship with Dr. Glassgold in 1998, where after rhinoplasty surgery, I observed carefully placed small amounts of silicone in the nose on a routine post-operative visit to improve the appearance of the nose. And I saw that there was no downtime, there was no patient discomfort, and I became fascinated by it because of its precision and permanency. It was done once or twice, and it never needed to be done again. It was almost too good to be true. I refined my technique after learning from the great Dr. Jay Barnett. Dr. Barnett is a practicing dermatologist in New York City. His daughter Channing Barnett has joined him in practice. And Dr. Barnett is not only a world-class dermatologist, but he's world-renowned when it comes to knowledge and expertise with silicone injections. He's been performing silicone injections for facial cosmetic purposes for over 40 years. And it's his 40-year experience that I gained the confidence to do this and offer this to my own patients, and it's my 1,300 procedures approximately that I've done to date so far that I base my current knowledge. There are two types of liquid injectable silicone that are available for purchase in the United States of America. One is called Silicone 1000, the other is called Adatasil 5000. The number next to the name corresponds to the viscosity of the fluid. So Silicone 1000 is 10 times more viscous than water. Adatasil 5000 is 50 times more viscous than water. So since I'm able to deliver Silicone 1000 through a 27 gauge, which is a relatively small needle, I prefer Silicone 1000 for most applications. It's FDA approved for intraocular injection. What does that mean? That means that Silicone 1000 is used mostly by ophthalmologists for a condition called retinal detachment, typically caused by CMV or a viral retinitis. And everything I'm talking about with respect to using liquid injectable silicone for facial cosmetic enhancement is an off-label application of these FDA-approved devices. In my experience, I've found liquid injectable silicone to be safe, natural looking, and in my hands, I can get predictable results. The versatility of silicone is what you're going to see by the end of this talk, because it can be used in so many applications in the face that to maximize a patient's experience ends up leading to a most youthening improved appearance. It's precise, which means it can be done incrementally in very small amounts, and its permanency is well reported. Several treatments, as you're going to hear through the talk, several treatments are typical, somewhere on the order of between 1 and 3, sometimes more, for a complete correction of any given problem. And in my practice, problems have not been typical. If you decide to move forward with this, you would schedule a consultation with me. So what happens during the consultation? We sit down, I find out what your concerns are, and we figure out whether or not liquid injectable silicone is right for you. This involves an informed consent that's signed, and in the informed consent, I explicitly state that we're using silicone in an off-label fashion, and that several treatments are typically necessary to achieve a desired result. I discussed that in my hands, in approximately 1% of procedures, you can get a nodule or a bump or visible product at one of the injection sites. And if I inject too much silicone, or if we do too many procedures, an area can be overcorrected. Rarely, about 3 in 1,000, I've seen some areas of prolonged redness associated with silicone injections that have all been self-limited in my practice. So after we get through signing the consent form, I take pictures, and then I will take some iodine paint on a Q-tip, and I'll mark the area for injection. We look together in the mirror to see if this is, to make sure we're both on the same page. And then after that, I place a topical anesthetic that renders the procedure nearly pain-free. When you get a treatment with liquid injectable silicone is different than a Radiesse or a Restylane treatment. The volumes are much less. In general, an area requires approximately 1/10 of a teaspoon, or approximately 0.5 to 0.6 cc's. To put things into perspective, most Restylane and Juvederm syringes are filled to 1 cc, so most physicians that use those products might inject up to 1 cc. I'm using approximately half the volume to achieve the same goal incrementally. Again, several treatments are expected for a desired result, and the treatment intervals are no sooner than once a month. After your treatment, I like to see everybody back 1 to 2 weeks later. We do after pictures, we sit down, I make sure that you're happy, and we make a plan for future procedures.